is the reason that you're providing inpatient services in an emergency setting, that there's a dearth of places for people to go?
Yeah. So I think it's the way I think about it is it's a little bit on both sides. So the input to our facility, so the input to the ER has gone up. So the number of behavioral health patients who are in crisis or mental health patients in crisis has increased. There's no doubt about that. You look nationally, and that's true across almost every pediatric hospital. So that number's increased. Some people have argued, I don't know that it's totally clear, that the severity of illness of those patients is also higher. And so things like the degree of suicidality or the degree of their crisis, however you define that, seems to be more than it was 10 years ago or even 5 years ago. So that means those patients need more help, and they need probably inpatient level of care more than maybe they did in the past. The other piece of it is exactly what you said on the output side, where there's just not as many beds and there's not as many places for these patients to go. And that's a combination of just staffing issues. That's maybe space. We just don't have the space for it. You can't get the nurses and docs there. You can't get enough social workers there to open all of the beds. So I think there's a dearth of rooms on the far end to get those patients to where they need to go. And so that leaves this one place, and we function as almost a holding center for those patients until those beds open up, which can be, like I said, weeks. It's really wild.